Hello everyone, this is regarding station. That's the you have to explain to the patient about the histopathology report of borderline ovarian tumor. So there are certain history points which you're supposed to ask to her. First of all, you have to make her comfortable that we are here to confirm the purpose, like we are here to discuss about your histopathology report. So will that be fine if I ask you a few questions, and then we can talk about the reports and what further we need to do about it? Will that be fine? Yeah. Do you have any idea about the reports? Did anybody you spoke to someone before that? Okay, so then coming on to the history points. History points will be, why did you go for the surgery, and then what was the indication? Now, how are you recovering? Is there any pain, bleeding? Okay, and any weight loss you had in the past, or any loss of appetite? And then ask about the chest pain as well, and the palpitation or breathlessness. These history points you can take about the if it is more aggressive. Okay, so then you have to take a gynae history. So this was your history of present complaints, like why did you go for the surgery, how are you recovering from the surgery? In all post-op patients, this is your pet question, how are you recovering? Because we ask it in general as well, that is there any pain, bleeding, blotting, loss of appetite, and because now we know that it is different than the expected. It's not benign, it's borderline, so maybe it is more severe. Yeah, so you just need to check with that, and any weight loss. So red flag signs also in borderline and malignancies, you will be asking about the red flag signs. So these are the important points. Okay, and then check about the gynae, about the periods, and about the intermenstrual bleeding, about the postcoital bleeding, and any difficulty during sex. What about the smears, and what contraception she was using, and then obstetric history you need to take, whether the family has been completed or not, because we may need to plan another radical surgery for her. Yeah, and apart from that, allergies we can't miss, so drug allergies. And in the family, is there any history of cancers, or in the self, because in the past she may have any breast cancer history, of anything that has been treated in the past. So you have to take history of cancer in self and in the family, both. Okay, and the support we need to ask, because now the news is also not good, and she may have to go for further treatment and tests. So support is required for her. Yeah, and mental health as well, and does she feel any low down in the past, and smoke alcohol, that's important, we need to ask. Okay, and what is the BMI? Then furthermore, now you check on her. The first, you have taken an idea that is there, do you have any idea, is there someone with you? Now you tell her that we don't have a good news, because that's not a good news actually. So we will be explaining her that the report is not what we expected. It is though not a cancer, but it can, the report which is showing that the tumor, the mass which we have removed, can turn into cancer any time in future. But now, as we have removed it, sometime it still can develop in other parts of the surroundings, like in the womb, in the tubes, and another ovary. So we may need to offer you some more special scans and some blood tests. Okay, so now we have to take a pause. When you have told her that I'm sorry, I don't have good news for you, the report which we have got about the tumor you had, it is showing that you have a condition which is not exactly the cancer, that tumor, but it is a precancerous lesion. It can turn any time into not precancerous, it can turn any time into the cancer in future. But as we have removed it, but as we have removed it, so the chances of turning into cancer are less. But still, because it can develop, so we have to take experts' opinion. We have to involve other doctors, other specialities. We have to recheck the tissue for its kind, and some special blood tests, special scans will be offered to you. Before that, let her vent out that whatever she need to ask is just give this information in pauses, not like I'm continuously giving it, because I want to make you clear about the situation, that if these many things happens, then you have to speak like this, and explanation will be like this, that MDT will be involving cancer doctors, we as your gynecologist specialist, my consultant, and there will be tissue doctor, x-ray doctor, scan doctors will be there. So, and there will be your staff which will be supporting you as well. There will be specialist nurse, and also your GP will be kept in picture, so that is the one who will be in contact to you first. So they will also be conveyed about all the informations and process what we are going to do. So is there anything which you want to ask? So just keep on asking like this. Am I making myself clear, or is it too much to take? And next thing you are going to tell her is that in this situation, you may feel low, or sometimes you may take it high on your head. So there is help available. We can help you in all situations. You can have my number. I'll be giving you my number, 24/7 number of the hospital as well. Whatever queries you have, we can meet next along with your partner, and I'll be conveying the similar information and even more, whatever you more wish to know. We will be talking again. Till that time, I can help you with the written information about this situation, this condition, and also some website links I can give you. Main concern is the follow-up. Like, we have to have a follow-up with you, even if you undergo any further surgery to remove the womb and tubes and another ovary, and some surrounding nodes are there. Those are, we call it lymph nodes, which are surrounding the blood vessels in your body. So those nodes also we may need to remove, or sometime you may need not to undergo any surgery. That will be the decision of the MDT, which will be conveyed to you. And if you want, you can also attend the meet. We will be offering you the invitation, and I'll be right now arranging the MDT meet with you. Yes, within 2 weeks you will be having the meeting scheduled, and then regarding the important part of follow-up, like for next for the first 2 years it will be 3 monthly follow-up, and then for next 3 years it will be 6 monthly follow-up for you, if this is the diagnosis for you. Yes, and after that there will be annual follow-up till the time the MDT or the treating doctors are happy for the progress, or for your condition, that now the chances of having it back are really not there or negligible. Then they may stop the follow-ups. Is there anything else I can help you with? Yeah.